Medical Society Presidential Citation to one of our colleagues who has served our society in so many ways with utmost grace, humility, and distinction, Dr. Virginia Latham. Her contributions to our society in organized medicine are many, and they span more than 3 decades and reflect a distinguished commitment to our profession. She has been a member of the House of Delegates and the Board of Trustees, a member and chair of many committees and task forces, president of the Middlesex Central District Medical Society, and a delegate to the American Medical Association. She has served as president of the Massachusetts branch of the American Medical Women's Association, a board member of Partners Community Healthcare, and the president of the medical staff at Emerson Hospital. In 2000, Dr. Latham became president of the Massachusetts Medical Society, only the 3rd woman elected to lead our membership, and her leadership led to significant accomplishments. Under her tenure, our society made its mark in the area of patient safety with the passage of a landmark Patient Bill of Rights. We upheld stringent requirements for patient privacy and confidentiality as new regulations at the time, the Health Insurance Portability and Accountability Act, came into being. And she co-chaired the search committee for a new editor for the New England Journal of Medicine, an activity that resulted in the appointment of our current editor, Dr. Jeffrey Drazen. As a member of the MMS Committee on Women in Medicine, later as its president, and to this very day, Dr. Latham has served as an inspiration and role model to all physicians and to those contemplating a career in medicine. On the 25th anniversary of the MMS Committee on Women in Medicine in 2006, the committee published a book of personal stories of 22 women physicians. The title of the book is, When You Don't Fit the Mold, Make a New One. Virginia Latham did just that. She came to our profession after 16 years of marriage and 5 sons. Having such a delayed start in such a demanding profession, however, did not curtail her achievements as a physician. Permit me to share a personal note about the time I first met Ginger. In the last months of their training at the New England Deaconess Hospital, residents and fellows in the Department of Medicine would spend several mornings reviewing the principles of airway management and resuscitation with physicians in the Department of Anesthesia. It was here that I met Ginger for several of those sessions in the FAR 5 operating room suites. Her enthusiasm, interest, and earnestness as she was preparing to begin her practice were immediately apparent, and I remember what an enjoyable experience it was. Our conversations covered many areas, and a few of them were about resuscitation and airway management. Let me take you back to June 30th, 2004, when the Committee on Women in Medicine sponsored an event entitled An Evening with Women Presidents of the MMS. That evening, Dr. Latham shared her thoughts about her career, along with the first 2 MMS women presidents, Dr. Barbara Rocket and Dr. Mary Lou Weissy. Dr. Latham's thoughts have been captured as part of that book of personal stories, and I would like to share just a few of those with you. In speaking to her colleagues, she talked about achieving a balance in life, and balancing medicine as a career and having a family was not an impossible dream. She talked about setting priorities and establishing values. And she talked about being a physician. And here is what she said. You are going to have the joy of a lifelong career that is really lifelong. You can always be doing something that is exciting and rewarding. You will have a sense of accomplishment when you look back on your life, because no matter what you do, even if you are just seeing patients every day, you are accomplishing a lot. We have opportunities to make a difference to one individual or the world, every day. Maybe you'll help solve the healthcare crisis. Maybe you'll establish new cardiac guidelines. Maybe you'll help a mom and a baby through a difficult delivery. Or maybe you'll just hold someone's hand. But you've made a difference every single day. Written and spoken more than a decade ago, those are words that capture the character of Dr. Virginia Latham, and those are the words that are just as relevant today, and those words are words that each of us physicians would do well to remember. It is with great pride that I present the Massachusetts Medical Society Presidential Citation to Dr. Virginia Latham. Ginger, would you please join me in applause?